All right,
All
Terry,
right.
take it away.
So I was unmuting me. Thank you, Terry. Good morning, everybody. This is Terry Woodward. I'm the Strategic Initiatives Manager with Mo Health Net Division, and I've been taking care of EDV for about the last 8 years. So most of you are pretty familiar with me. And we're meeting today. Before we did our soft launch for claims validation, we promised that we would do a follow-up with all of our providers and just kind of let everyone know how things were looking, where we were, how the launch was going, try to answer any questions that you might have. So that's the intent of our conversation today. So I do have a couple of people on the webinar with me who will be popping in. I'd like to give them just a minute to introduce themselves. Let me get started. Renee, if you would go first, that'd be great.
I'm Renee Riley, and I've been working with Terry for the last probably 5 years on this project, and I do all of the CMS reporting. And then I also help with any provider issues that's coming in that need my assistance. And since we're in the claims validation, that's kind of my specialty, and I assist with that as well. And I'll turn it over to Carrie.
Hi, everyone. I'm Carrie Bruns. I am actually a consultant with Barry Dunn, but I am contracted with MHD since 2021. I've been supporting Terry and the team for project management services with the implementation of EVV. So I've been around for a while, and you may have been in attendance to some of our trainings. So hopefully you guys will learn a lot today, and we're happy to be here. I'm going to turn it over to our friend Darla Weekly and let her introduce herself.
Good morning. This is Darla Weekly. I'm with Missouri Medicaid Audit and Compliance. I am the provider review and lock-in manager here at MMAC. I've actually been on the EVV project with Terry probably back when we started with design back in 2020, probably farther back than that. So we're going to listen in today, see if we can learn anything. And again, like they said, if you guys have questions afterwards, you'll be able to do that with probably through some kind of communication, either email or some other thing like that. So thank you.
Thanks, Darla. And moving forward, I think Daniel might have a little more opportunity to talk with you guys around EVV as well. So Daniel, do you want to just remind them who you are, and then I'll quit bothering people and start my
Absolutely. So my name is Daniel Rush. I know a lot of you know who I am from webinars and other things. I'm one of the educators here at Mo Health Net that's over the Home and Community-Based Services program. So I hope to be in some trainings with you guys moving forward.
Thank you, Daniel. So we have a pretty full agenda today. As Daniel mentioned, we intentionally are not allowing chat or questions during the presentation. The last time we had this many people all together, we kind of all started chatting and talking and went down a lot of rabbit holes. And I think a lot of the content kind of got overlooked because we were distracted by what was happening in the chat. So as Darla and Daniel both said, we will have some opportunities to address unanswered questions, but we did take questions ahead during the registration process. So we're going to try to accommodate most of those questions throughout the course of our presentation. So flip back 1 second for me, Carrie, and I will go. So our agenda, we're going to be talking about the soft launch, where we are with that, how things are looking, what providers should be doing. We'll have a high-level claims validation overview, just kind of what claims validation is, where we're going with that. Carrie's going to show you some things about moving around in the aggregator solution. She's going to show you some reports. And then finally, we will have a wrap up where we talk about the hard launch and what our timeline for that looks like. So we are ready for the next slide now. Thank you. So the soft launch for claims validation took place for all of our different provider types that require the use of EVV on January 7th of this year. So we've been at it for close to 2 months now. So things have been going really well. During the soft launch period, all that means is that we are not denying claims for purposes of EVV. So what happens is whenever a claim is submitted for a type of service that requires electronic visit verification, it goes through all of the pre-existing checks and balances with EMOMed or wherever your claims are being sent through. If it looks like a good claim and in the current time it would pay, there's one more step that's been added to the tail end of that process. So those claims that are ready to be paid get sent over to the aggregator solution to look and see, is there a visit here that matches this claim? So if you have been paying attention for all the past years when we've been talking about EVV and where we were going with it, this is the moment that we've all been waiting for. So we've been telling you from MoHealthNet's perspective, from MMAC's perspective, we've been saying you've got to use EVV. You have to use it all the time. Your information has to be correct in EVV because we're going to start matching your claims to those visits. And that's what's happening right now. During the soft launch, your claims are still getting paid, even if you're not using EVV correctly, but that's going to be changing in the very near future. So right now, claims are still being paid. You get a notice on your remittance advice if you submit a claim and there's not a visit in EVV to support it. Renee's going to talk a lot about the remittance advice, what we're looking for, how to handle those things on there. But that's a very important tool right now, is to be using your remittance advice to identify a claim that doesn't have a matching visit. So the whole intent of this soft launch was to give all of our providers a chance to kind of get used to the process and to understand what they need to do, first of all, to get their visits to the aggregator solution, which we should have been doing for a long time now. But more importantly, if the visits aren't there or not matching your claims, we want you to understand what you need to do to remedy that before it actually has an impact on payment. So, our next slide, please. Thank you. So we should know, everybody on this call should know what is required to get a visit into the aggregator solution, into your EVV system. We have all those Cures Act requirements of what we need to do to get a verified visit into the aggregator solution. That is more important than ever, because if your visits in the aggregator are not in a status of verified, they will not be considered for claims validation. So that means if you have visits that are missing a call in or call out, or if you have a visit that doesn't have a task, any of those things, if they say that they are incomplete, they are out of the game. So it's very important your visits have to be in a verified status. So that means you've met all your Cures Act stuff, right? You have a visit in verified status. When the claim comes to look at the visit, the things on your screen is what is going to be matched. So we're going to be looking, does your provider Medicaid ID match? Does your DCN match? Are we talking about the same participant here? The date of service must match. Your procedure codes and modifiers, we have to make sure your claim matches the service on the visit in the aggregator. The units have to match. So we know sometimes the units aren't a perfect match. The caregiver might be there for 2 hours and 20 minutes and you're only going to be billing, for the 2 hours and 15 or whatever. But there always has to be at least as many units in the aggregator as what you're submitting on your claim. So if you submit a claim and everything matches, but your claim is for 11 units and there are only 10 units in the aggregator, that's not a match. So it's very important to make sure your claims have no more units on them than what you actually have on your visit in the aggregator. All right, our next slide is what you should be doing now. So first of all, as we've been saying all along, you need to be using EVV for every single participant for every single visit. So big picture, that's what you should be doing now. But in addition to that, due to claims validation, before you submit a claim, it's a good idea to log into the aggregator and make sure that the visit matches. It's in a verified status. Now, I know some of you have tons and tons of claims, and it's not realistic to look at every single one. but I would at least do some spot checking and go in and make sure that what you're seeing in the aggregator solution matches what you're submitting on your claims. Take a look at that. Make sure your visits look clean. If you have an accrued minutes visit, and we're going to talk a lot about those as well, that's just a way to accommodate those minutes that are outside of 15-minute increments. You're going to want to make sure that you have a visit in the system in the aggregator solution before you submit a claim for those extra minutes, because if you don't have a visit to match, your units are not going to be adequate. You should be looking at your remittance advices. And as I said, Renee will talk to you about what to look for. But any claim that you submit that doesn't have a matching visit, there's going to be a remark on your remittance advice that tells you that. And then we're also going to talk pretty at length today about some of the reports that are available to help you tell which claims would be matches, which would be failing. So we have a lot of things to get through. If some of the things I've just said are very foggy to you, don't panic. We will be talking a little bit more at length about them. And I think now Renee is going to talk with you a little bit about kind of where we are following the soft launch.
Thank you. Yes, this particular graph was taken a few days ago, but as you can see, we're at 71%, over 71, almost 72% successful. And what that means is we have a match in for claims for these EVV visits. That's just awesome. So this has been a very good, successful project so far. What we are seeing, there are some significant reasons why you may be getting a remark code on your remittance advice for verified visits not found for procedure code and date range. It's kind of cut off here, but that's what this dark blue is. That's 13%. And what that is a visit was not found for the given time frame that matches the procedure code within the request for the identified providers or the participants for the date range in a verified status. So you have a verified visit, but it's not matching something in the aggregator to your claim. So that's why you're seeing that. And also, like, the 11% is unmatched units. And that's a big one. That's a big one as well. And as Sherry talked about, the accrued, I shouldn't think of the word, accrued minutes visit, that's kind of where we're seeing a lot of those, where that accrued minutes visit is being entered with the same line as another on another claim, but you're actually not submitting it to the aggregator till after that. So it's a timing thing. So you got to make sure that you have a proper amount of units in the aggregator for that data service, for that procedure code, for that participant before you submit the visit, or before you submit the claim to EvoMed or batch billing, however you do that, however you do your billing.
Hey, Renee,
Hi.
this is Carrie. Hey, I'm gonna switch to the next slide where we talk more about the error trends. I think that might probably help.
Sure. Yep, I'm
Sorry
ready.
about that. There we go. Okay. I didn't want to cut you off. Okay, go ahead.
No, we're good. So these are the trends that we're seeing. The claims are being submitted before the EVV vendor sends the visit to the EVs. And that's what I was talking about with the improvements visit as well. We're just not seeing, or they're sending them at the same time. Well, if you're submitting it at the same time that you're entering it in your EVV system to MoHealthNet for payment, it doesn't have time to make it to the aggregator. So you need to make sure that you're allowing that time for it to get into the aggregator system. And that's where you need to be checking to make sure it's there before you submit your visit, or before you submit your claims. Your visits need to be in the aggregator before you submit your claim to EvoMed, to MoHealthNet, however you do that. EVV is not used for the provider for each member for all required services. So we've seen a lot where it's kind of like they've picked and choose their participants that they want to send over to the aggregator, not the entire population that have EVV services. So if they're receiving any type of EVV service, they need to be loaded into your EVV system, and then those participants need to be sent over on a list to the aggregator so that they can accept those visits. And then providers, the provider's EVV vendor not sending visits to the ease daily or at all. This is where you definitely need to be logging into the aggregator to make sure that all of your visits are there, that your vendor is doing what they're supposed to do, and making sure that they're there before you do your billing. And then visits in ease not in a verified status. We see this a lot. A lot of times it's just that they are you would get this not in a verified status if you miss any of the elements on your claim or on your visit that's just supposed to be there. That could be your missing task. That's a big one. Missing memo for some provider types. It just depends on what provider type that you are, some of the different nuances that you would have that wouldn't be in a verified status. So again, you're logging in, you're making sure it's a verified status, and it's easy to do. You can do a date range for your visit review, download that visit into an Excel, and you know whether your visit is verified or not. You would just filter on that particular field. Mismatch units, again, the accrued minutes visits that we're seeing a lot of that where it's just a timing thing. You actually have the visit there, but it's not being submitted to the aggregator by your EVV vendor before you bill. So it's a mismatch. All right, next slide. And I'm going to turn it back over to Terry for a few minutes.
Thanks, Renee. So let's talk a little bit. We have been referencing accrued minutes, but just to get everyone on the same page with that. In Missouri, when our unit-based services, it's 15-minute increments. We don't allow any rounding. So we don't round up, we don't round down. It is what it is. However many 15-minute increments, that's what you can bill for. So could you guys please mute yourselves if you're not a presenter? So we currently allow for this practice of billing for those accrued minutes. So that means that if you have over 15 minutes on any given day, you can save those minutes up. So if you go out and you're there for 20 minutes, you can bill for one unit because you have 15 minutes, but you have that extra 5 minutes just hanging out, right? So you can add those extra minutes up throughout the course of the month, and when you get to 15 minutes, you can call those an accrued minute. That's a unit made out of accrued minutes. So our challenge was, as we've talked a couple of times already in this presentation, your units have to match your claim. So there really isn't a visit that's going to match exactly with those accrued minutes, because it's a combination of all different visits. So it's kind of a mumbo jumbo. It's different dates and different times. It should be the same service, but it could be different tasks. It was a challenge to figure out how to accommodate for that. So what we decided to do, and we're going to talk a little bit about that on the next slide, we created a special visit, and we called it an accrued minutes visit. That's very catchy, right? So it's an accrued minutes visit. So all that really is, it's a visit that you're going to enter into your EVV system. They're going to send it to the aggregator, and it's going to be, this visit is a combination of minutes from other visits throughout the course of this month. You have to use them within a month. Whatever's not used at the end of the month is just lost. But throughout the course of the month, these are minutes that I had left over. They added together. I got to 15 minutes, so I'm going to bill for a full unit. So we created a certain visit type. The way those are identified is with a reason code. It's reason code 280. And that code, anytime MMAC or MHD or anybody sees that code in a report or in the aggregator, we know that means this is accrued minutes visit. They have to be sent to the aggregator. These have to be entered manually because there is not a real clock in or clock out because it's a combination of things. But we do want you to know that even though it is a manual call type, it doesn't impact your auto versus manual percentages. So we report to CMS and we keep an eye on providers to make sure that most of their visits are being entered automatically, which means clock in, clock out in the field. Everything is entered at the time of the service. We don't want a lot of manual visits because manual means either it didn't happen when it was supposed to, or it happened and it was wrong or missing something. So these visits are excluded from the manual count because there's no other way to enter them. They have to be sent to the aggregator in 15-minute increments. If you try to send 14 minutes or 32 minutes or anything that isn't divisible by 15, those visits will be rejected. So make sure they're 15-minute increments. The visits have to have every single data element that you must have for a verified visit. So you're going to have your provider ID and your DCN and your units and procedure codes and all of that. The only thing that there's a little bit of wiggle room on is the tasks. We didn't want providers to have to figure out, oh my gosh, what tasks were actually done during these extra minutes. So we created a new task code. It is 0280, and if you use that task code, you can only use it if it's an accrued minutes visit. But if you use that task code, you don't have to actually enter any task to identify what happened during the visit. So it's a standalone code. If you provide services through the Department of Mental Health and your services require the memo field to be completed in order for your visit to be verified, you can just simply type in there, this is an accrued minutes visit if you want to. That will meet the needs of the memo field. A lot of the times we recommend to providers, if you want to take a minute to actually use that memo field to identify the dates that those services were actually accrued, that might be helpful for you for tracking purposes. But we also do have a report that we're going to show you that is very helpful with tracking your accrued minutes visits as well. We do ask, if at all possible, to try to not overlap your accrued minutes visits with a regular visit that took place on that day. So if that person actually received the service that you're billing that accrued unit for, try to not overlap. If you do, it's not going to reject or anything. It's just a little bit cleaner if there isn't any overlap in those visits. So what do we have next? I think we probably have some questions. Yes. So these are questions that we received ahead of the presentation that folks were kind of having some concerns about accrued minutes and how that works. So the first question, how are they handled under EVV? So it's kind of a two-part thing. We want to make sure, and this is just kind of a review of what we just talked about, right? So under EVV, you've got to track. Providers have to know when they get that 15 minutes, when it is billable. You can either, when you get to that 15 minutes that has accrued into a full unit, you can create your visit and send it that day, or as soon as you're aware of it. Or some providers prefer to wait till later in the month and see and do it all at once. There's not a requirement as to how you manage that. They do have to be in 15-minute increments, and you do have to have that visit that accommodates all those accrued units in the aggregator solution before you put them on your claim. So you can add it to your claim, but the units have to be present in the aggregator before you submit your claim. Accrued minutes, are they required to be billed? I think, Darla, I don't mean to put you on the spot, but would you kind of like to address this one for me? Because I feel like it's a bit of a concerning question. Maybe Darla doesn't want to talk about. Oh, there you are.
Oh, sorry. I'm double
You're good.
muted. I'm sorry.
You're good.
Yeah, so it's totally up to the provider whether or not they bill for the accrued units. I mean, it's extra units hanging out there or extra minutes. So because they can't round, this at least allows for them to create the extra visits so they can bill for the accrued. Now, if we see a whole bunch of accrued units hanging out there for a provider, we may question why, because that's one concern a lot of providers had, is that they want to be able to build those units because, you know, they have to pay their staff and other things like that. So yeah, I mean, they're not required to be billed, but you know, you won't be able to get paid for them if you don't go through and figure out where all those extra units are and you don't bill them. So
Thank you, Darla. So the next question, how do providers bill partial units or minutes that are not full units? And the answer to that is you can't. We only are able to bill in 15-minute units. So at the end of the month, if you have anything that is not exactly in a 15-minute, anything up to 14-minute, you can't bill for those. So they're just lost. So it is really important that you keep track of your accrued and add them together and get the most out of them as possible. So task codes for accrued minutes visits, we just talked about that. We did create a specific task code that is the 0280, and that's the only task code you have to use if you are submitting a visit for accrued minutes. And then lastly, what happens if a vendor can't map accrued minutes or tasks? So as part of our state regulation, any EVV vendor doing business in the state is required to update their system to accommodate Missouri programs and policies. So if you do have an EVV vendor who's saying, I can't add this 280 reason code, or I can't add this task, then you need to reach out to them and say, the state requires you to do this. If your vendor is unable to do that for you, MHD needs to know about that because they're not meeting the requirements of the state, and they very likely will be removed from our list and won't be able to provide services here. So very big deal to talk with your vendors and make sure they understand the expectation is for them to do this, and that if they don't, that they are not in compliance with our state regulations. And I think that I'm going to flip this back over to Renee to talk to you about remittance advices.
Yes, thank you, Terry. Yes, a remittance advice. Okay, the N363 remark code that you see on your remittance advice. It means in the near future, we are implementing new policies, procedures that would affect this determination. We had to choose something that would not be a denial, because we are not denying your claims at this point. It's a soft launch. So we had to go with an alert, what they call an alert, through the Washington Publishing people that make up all these remark codes and all the rules and regulations for what we can put on our remittance advices. So that's what it means. I know it's very generic, but right now, EVV is the only one using the N363 in the MoHealthNet system. So if you receive this alert, you know that there's something wrong with your visit NE. It appears on your RA, and it's within your RA. It's not like a denial. It does not appear at the end of your remittance advice because it's not a denial. It's a soft launch. We're not denying for anything right now. We just want you to be aware that in the future, this could be a denial. And so you're receiving the N363 so you can do research in your aggregator system. We do not want you to resubmit the claim because it's already been paid. We want you to research in the aggregator system and get that all corrected. So when we move from soft launch to hard launch, you won't receive anything on your remittance advice and everything pays. That's the goal. So we're just requiring you to log into the e-system. You need to do it at a minimum once a week. That's in regulation. But I would do it definitely every time that I have a question on billing, like, okay, is everything in the aggregator before I submit this claim for payment? It's just a good practice to have. so you can compare them. Okay, let's go to the next slide. Okay. And you're going to receive this alert for every type of possible reason why it wouldn't go through the aggregator. Because I only had one alert code that even remotely worked out of the thousands that are out there. Because it's usually when you have something on your remittance device, it's due to a denial. But this remark code is actually just an alert. So we were able to incorporate it with a soft launch. Once the hard launch hits, you're going to have different denials for each type of one of these scenarios. The provider ID did not match. What that means, a lot of times what we're seeing is several, not all, providers have two 26 provider types. One is for their regular PCS, and one is for their CDS, or consumer directed service. It's the same provider type in the MoHealthNet system, but sometimes they want to keep, for some reason, they want to keep those separated. Well, what we're seeing in the aggregator is they may all be under one of those numbers. So when you bill to MoHealthNet, you're using a different provider number, and it's not matching in the aggregator. So that's where you would kind of see some of those issues. Participant DCN not matched. Okay, the participant from the claim did not match in the aggregator. Well, it's probably missing from the aggregator, meaning you may have it in, maybe you do Homemaker Tour and you do personal care for a provider or for a participant. And when you send it into your EVV system, you only registered one. Oh, that participant was one of those services, not both. And then when it got to the aggregator, we don't even see that they've registered for one of those services. So basically, your EVV vendor has not sent over the entire client list to, or participant list, however you mark them. I think it's marked client in the aggregator. Participant is what we call them at MoHealthNet. They don't have the full list. So that's where you would receive that participant DC. Okay, and then we have unmatched units. That's a big one, and we've talked about that a little bit before. It's just a lot of them is your increased minutes visits are not being billed at the same time, or they're being billed at the same time, but they're not being entered in the aggregator at the same time. That's not the only case. It's just maybe your system rounded up and it shouldn't have, because we're going to do whatever, or round it down or whatever when you were billing, and it shouldn't have, and it doesn't match what's in ease. So they have to match, at least. You have to have at least as many units as you need in ease to match your claim. And visits not found for the procedure code and date range. And that could be either your verified visit was not found in the ease for the date of service on the claim, or the verified visit was not found for the procedure code. A lot of times on the service wasn't found in the claim, it's a timing thing. They're submitting them at the same time, and you can't do that, because you have to have allow time for your EV vendor to get it to the aggregator before you bill. And then visits not in a verified status. And again, if you don't have the right, any of those provider, and any of the top things above there, if they're not present on the visit, it's not a verified visit, so it won't match in the system. Okay, next slide. And then the remittance advice. Like I said, the N363 falls within the body of the remittance advice, not at the end where all the denials are usually located. So what you need to do is download this, just like I did here. This is an example of it. We have blurred out all the PHI. You would download this, and then you would just Control F, which is control find, and type in N363, and it will highlight all of the N363s. This one has, this is a big provider, has 412 of them. So, and then you could go in and match that to your visits and ease and be able to know why it's not matching in the ease system. Is it an unverified visit? Is it a verified visit, but we don't have enough units, whatever that may be. Okay. And then next, and once we hit the hard edit, the denials will be at the end and they'll be different. It won't be N363 at that point. Okay, sorry. All right, and then we had some questions that we got. It says, what alert remark code N36 and what does it mean? We went over that. It means in the near future, this procedure code the policies and procedures would affect the determination. And then why are providers receiving N36 on their remittance advices because something doesn't match in ease, and how can we tell on the RA why we received the N363? You really can't tell on just looking at the remittance advice why at this point. Hard edits will be different, but this one it's very generic. So you're going to have to use the aggregator, and Carrie's going to go over some reports that would help you identify exactly what went wrong with that and why you were receiving this on your RA. It's a document explaining N363 and related EDD codes. Well, we just had a bulletin that came out on last Thursday, that actually talks about why you would receive the N363, what it means, and where to find that, and that's at a link here. And we will have this posted later for you guys to review as well, the PowerPoint. And next slide. And this is a team effort, I think. So how does EVV data impact claims submissions and approval? Well, we just went over several, why you would receive a N363 and that it doesn't match. And then, like I said, Carrie's going to go over some information for you to see what it's not matching in ease. That's the easiest way to figure it out. And then what is the correction and resubmission process for EVV claims and N363? Well, right now, if you get an N363, it's a soft edit, meaning claim paid. So you do not want to resubmit your claim. So you don't have to do anything there, but we want you to correct it in your aggregator or your EVV solution, and then it'll be sent to the aggregator and correct it there.
So I'm going to stop you just a second, Renee,
Sure.
and just elaborate on that just a smidge, because I'm gonna get Darla to jump in here again in a second.
Okay.
So if you're looking at your remittance advice and you see that you have an N363 related to a certain claim, you know that there's something wrong with that visit. So you're going to go in, you're going to log into the aggregator solution, you're going to find that visit. You're going to figure out what's missing. Are the units not matching? What's going on with this visit? Then you're going to have to go into your EVV system, and so it might take a little bit more work because you might not know why the visit is wrong. Maybe that the aide forgot to clock out and clocked out at a way different time and never told the office that they messed up on their clock out or whatever. So you might have to do some research to figure out how that visit needs to be fixed. We don't want you to just go and fix it and say, oh, it has to match the claim. Like, we want to make sure it's right. But once you identify what is wrong with that visit and what needs to be fixed, you're going to enter that into your EVV system, and they're going to send that on to the EAPS. But what I want Darla to talk with you just a minute about is that we can't have it taking a month to go in and fix a visit if you see that there's something wrong with it. So I just kind of, Darla, if you don't mind, to just kind of talk about the time frames for making those corrections and resubmitting the visits, I would appreciate your input.
Yeah, so we've had several questions about this, and it is in the EVV regulation that basically says Any adjustment or exception requires the provider agency to enter justification documentation into the EVV system, which may include an editor program within, it has to be done within the documentation timeframe requirements that are established in the administrative actions with DSS. And that the definition of the time frame is contemporaneous. Contemporaneous means 5 business days. Now, back when we first started doing the aggregator stuff and there was another regulation, it had talked about providers, if you had to change something on the visit, you had to manually go in and adjust it, that you had to have a paper timesheet or something that supported that. But since then, we have found out from providers that sometimes the staff calls that day and says, hey, I forgot to clock out. I was working for so-and-so. I left there at 3 o'clock. The provider verifies with the participant. They said, yeah, they left at 3. So they make a note in their EMR system. It's there. But then they wait 2 weeks before they realize, oh, the visit didn't get verified because I don't have a clock out time. They have justification and they have it documented somewhere within those 5 days that they needed to go back and fix the visit. It's when you go months later, or you even go a month later, and you go back in and you fix a visit. You add task, you add a clock in time, you add a clock out time, you add a memo. Where did that information come from? So if you have to fix something, you know, you should be doing it within the 5 business days. It's a requirement within the regulation that it says that. So it's another reason why you should be looking in the aggregator at least once weekly. And when you find incomplete visits, that's where you need to make sure you're going back and you're fixing it and you're putting whatever the reason is. Person forgot to clock out. Now, if you have a whole bunch of manual visit adjustments, it's going to tick something with MAC to say why. Because you can have a provider and they may have 20 participants, but only one participant has a whole bunch of manual visits because the provider had to go back in and fix something. As a provider, you should also be looking at that. If you constantly have to be fixing a visit for a participant or a staff, you might want to be questioning why. They should be clocking in, they should be clocking out, they should be adding tasks if it's required, they should be putting the memo in there if it's required for your provider type. If you have a staff that's not doing that, then I would say you need to have a discussion with the staff and ask what the problem is. But that's where the 5 business days comes in. It is in the EVV regulation that it says that if you're doing an adjustment or an exception, it has to meet the documentation time frame. That hasn't ever changed. That's the way it's always been. So I don't know if that's helpful or not, Terry.
Nope, that's exactly what I needed you to explain. So thank you very much. I appreciate it.
Yep.
And I'll just, since I'm already talking, I'll just grab that last question on here. How do we know claims were successfully submitted and accepted? So we are going to move into a little piece of this presentation where we talk about reports and how you can utilize those reports to see the status of your claims and see what's going on with them. So I think that will be very helpful. You also will know, so right now all your claims are being accepted. They're all being paid during the soft launch. So during the hard launch, it becomes much more important, but you will know if you print out or you look at your remittance advice and you don't see any of that N363 code, you will know that all of those claims were successfully matched with something in the aggregator solution. So you can use your RAs, you can use the reports in the system. And I actually think that Carrie, is that what we have up next, is looking at some of the aggregator pieces and talking about it?
So I have to email them to get an updated one.
Hey,
If
guys,
I gotta
could you
go to
please
court, I can show it
mute-
then, or have my lawyer.
could you please mute if you're not presenting? Thanks.
All right. Thank you so much, guys. Okay, so what I wanted to talk about, there have been a lot of questions about the visit statuses and ease and what do they mean and how will you be able to tell if your visit is being included for claims validation or if it has had a successful match. So I just wanted to review a little bit the visit statuses and hopefully these screenshots that I have here are very familiar to you and that this is exactly what you see in the visit review when you are in the aggregator. So we have 4 different statuses, right? So we have, I'm just going to start down here at the bottom though. We have omitted. Anytime that data is submitted to the aggregator, it's there forever. We can't delete or remove data once it has been submitted. So if you accidentally submit a visit, maybe under the wrong client, under the wrong account, the only way to basically get rid of it is to mark it as an omitted status. That is essentially a delete, and it equates to a do not bill. So if you're submitting a claim for a visit that has an omitted status, it's not going to look at this visit at all. That processing is not going to look at this visit at all because you have it marked as an omitted status and a do not bill. Okay, so if you have a service to replace this visit, you're going to want to make sure that that visit is in a verified status and that it is in the correct account and for the correct client. So that's omitted. Just remember that if it's an omit status, that it is not being included in the claims validation process. Okay. The next one is incomplete. So an incomplete means that one or more of the required data elements, either for the Cures Act or for Missouri EVV requirements, is missing. It could be a number of things, and I'm going to go through those here in just a second. But if you have a visit that is in an incomplete status, it will not be included for claims validation. Okay, so it has to be in a verified status in order for the system to check it for claims validation. Okay, so verified means that all of your required data elements are present. And you can see that when you pull up your visit review in the aggregator, this visit status column will display, and you can quickly see what the status of your visit is. Okay, so processed is a new status that was introduced for the claims validation process. And what processed means is that there has been a claim that has been successfully matched to this visit. So when you're going through the aggregator looking to see what visits still need to have a claim submitted, it's going to be really easy for you guys to see at the visit status that it's been processed. Okay, so that's a great indicator that this visit has already been paid. Okay. Let's see. So some of the most common ease exceptions are that we see a lot, like this missing task exception is the largest exception that we see. And that means that for specific DSDS services, those services require tasks. So if you see an exception for missing task, you just need to log the tasks in your EVV solution and then have your vendor resubmit the visit to the aggregator. Okay. And I kind of got ahead of myself, but really quickly, when you guys pull up visits in the aggregator, in your visit review, you may see little red dots. These little red dots indicate an exception. So you may have a visit where you see a red dot under the tasks, or you may see a red dot under the call in, the call out. This means that there is an exception that is posted for that. So you can look at this visit here and see right away that, oh, this visit is incomplete because it's missing tasks. And I know that because of the red dot. And the more that you guys are in the aggregator verifying your visit information, this stuff is you're gonna know right away. The more familiar you get with it, what's wrong with your visit without going into details. If you're not sure why your visit is in an incomplete status, you can go into the visit by clicking this little eyeball, or you can click on any of these fields within the visit review. And then there's an exceptions tab. And this exceptions tab will tell you what is wrong with your visit. It's going to tell you what missing data element needs to be fixed in order for it to be in a verified status. Okay. So some of the other exceptions that we see are visits without any calls. That means that your caregiver just simply didn't clock in or out. So the visit was submitted to the aggregator without a clock in and a clock out. So you would need to fix that visit in your EVV solution or your EVV system by sending adjusted clock in and clock out times, and then have your vendor resubmit. Visits without an in-call, your caregiver just simply forgot to clock in. I mean, we're human, we forget. So simple fix is to adjust that visit in your EVV solution with an adjusted end time. Same thing with the out call. Your caregiver just simply forgot to clock out. For DDD services, visit memo requirement is not met. For those particular services, we require a memo to be submitted along with the visit instead of tasks. So we do see that quite a bit. Again, to fix that exception, you just need to go in and make sure that the visit memo fits the required minimum and maximum character range and resubmit to the aggregator. Okay, so we had some questions, as I said earlier, about the EVV statuses and errors.
Hey, Carrie, can I interrupt you for just a
You
second?
can, yeah.
I think, well, I'm just thinking that maybe for the sake of time, we've kind of talked through these questions. Maybe we can try to look at the reports and stuff and then come back to these if we have time.
Yes, it
Are you
is
okay with
almost,
that?
are almost out of time. Yes. All right. So, and I don't want to speed through this, so you guys hopefully can just stay on. So this first report that we're going to look at is the accrued minutes visit report. This report is amazing. This is a date range report. So when you go into the aggregator and you go to your reports tab, you're going to want to select the date range option. Okay. So you can run this report for, I believe it's up to a month's worth of data. But what this is going to show you is all of your visits, and it breaks it up by client, or your patient, your client, and for the date range. But what it's going to show you is all of the visits for this client within this date range. It's going to show you the total minutes for this visit, and then it's going to show you any accrued minutes that were left over after this visit. Okay, so then as you're going through and determining whether or not you have enough units to create an accrued minutes visit, it will tell you when you have enough units to submit an accrued minutes visit. And it's also going to show you if you have already submitted a visit for the accrued minutes visits. It'll show you how much minutes or units were submitted for the visit. And then at the end, it's going to subtotal it. So it's going to subtotal all of your minutes for this client within this date range. And then it's going to show you any leftover accrued minutes that you have and that you are able to submit this many
One
accrued units. So this is really a great report. And before you guys
Accrued minute visit.
bill any type of claims, I highly recommend that you guys go out here to this accrued minutes visits report. Make sure, one, that you have submitted any accrued minutes visits that you are going to account for. And then if you haven't, make sure that you check out your totals down here to see if you have some accrued units to bill. If you do that before you submit your claims, so you don't have that error for units mismatch. Okay. The next report that we're going to utilize for the claims validation is the claims verification status. This is a billing report. So when you go to the aggregator to your reports menu, you're going to select billing. Okay, and then it's going to list this report as an option. So what this report does for you is based on your date range, and I believe you can select up to a month, and then it's by visit date. So you can run this report and it's going to show you all of the visits within that date range. And it's going to, what I really want to point out is this status column. So at a glance, you're going to be able to see all of your visits in an incomplete status, an omit status, the process status, and the verified status. So you can easily see at a glance, oh my gosh, maybe I have 5 visits that are still incomplete that I need to fix before I can bill. Or I have, say, 20 visits that are still in a verified status that I have not yet had a claim either successfully processed, or I still need to submit a claim for these visits. Or I have this visit here on February 2nd it's in a process status. So that means that I've already billed for this visit and I have a claim that has successfully processed. And this will tell you this visit verified date. This was the date that the claim was submitted and was verified against the aggregator. So this is an awesome resource for you guys when you are trying to decide what visits still need to be billed for, what visits have already been accounted for in the claims processing, and any visits that are still in an incomplete status that you need to take care of before you can bill for those. So this is an awesome, awesome, awesome resource for you. The next one that is going to be super helpful for you guys is this claims validation rejection report. So this report is single date driven. So what this means is that you can only run this report at this time for a single date. And this report, instead of utilizing a visit date, it uses the date that the claim validated against the aggregator. So when you run this report and you're not finding results, just keep in mind that this report runs by that claim submission date. Okay, so just keep that in mind. We do have some enhancements right now with SANdata to change that functionality where it will allow you to run this report for a month at a time, so up to 31 days at a time, and by visit date. So stay tuned for some upcoming announcements for changes to this report. But the bottom line is that this report is going to show you on any particular date what visits or what claims have been submitted to the aggregator and why they denied or why they rejected, why their claim did not match a visit in the aggregator. So when you run this report, you'll be able to go through here and say, oh, client 12345 had a claim submitted for January 7th for service code T1019. And I know you guys know what this means. Bill unit. So I billed my claim for 9 units for this date of service for this client for this account, and there were no visits found. So what you will want to do is then go back to the aggregator, and 9 times out of 10, you probably forgot to either make sure this visit was in a verified status, or maybe the visit didn't get submitted at all to the aggregator. So those are things that you're going to want to check when running this report. And you can see down here on this 3rd visit. So for example, there was a claim submitted on 1/8 for this service. 12 units were billed on this claim, but it rejected for unmatched units. You billed for 12, but oh, look, you only had 11 units in the aggregator for this date of service, for this client, for this account. So that's a great way for you guys to go out and make sure that you are matching your claim to what is in the aggregator. Okay, so this is going to be a great resource for you guys as well. So some of the questions that we had on reports, what reports should provider run in the aggregator? You're going to want to run all 3 of these that I just walked you through. The accrued minutes visits. Look at this report first. Make sure that before you bill your claims that you have accounted for all of your accrued minutes. Okay. Then you're going to want to run this claims verification status report for the dates of service that you're getting ready to bill for. Make sure that all of your visits are in at least a verified status. Okay. If they're in a verified status, you're going to want to make sure that you have a claim for these. If it's processed, you're not going to want to bill for that one again, right? If you have claims that have rejected, or well, they're not going to reject yet, but if you get that N363 remark code, you're going to want to come out here and make sure that you fix these visits in the aggregator before you resubmit. Okay. So what reports are required to retain for audit and compliance purposes? This is honestly more of an MMAC question, but for right now, I'm going to hold on letting Darla respond to this one. Can providers print reports for their own records? Absolutely, you can print reports from the aggregator. Just keep in mind that when you print the report, the time that you print that report it's just a snapshot in time. So if I were to have run reports this morning, if I run that same report with the same criteria this afternoon, it's going to be different. And it's going to be different because your EVV vendors, you guys are always adding new visits. Your vendors always uploading visits to the aggregator. So that data is always changing. So just keep in mind that if you're printing these reports, just remember that that's only a snapshot in time. Okay, so just remember that. Absolutely, print your reports, save them, they're yours. So you just have to remember that it's only a snapshot in time. How do we identify mismatched visits to claims through reports? And I just walked through that, okay? If you have some claims that have that rejection or that error code, come out here, run this claims validation rejection report. Look for the claims that were submitted, validate these error messages, and then go out to the aggregator and to your visit review and do your research. Who should be contacted if visits or billing data are missing? If you have discrepancies in your reports, you need to contact your EVV vendor to make sure that they are submitting the information correctly to the aggregator. And then if through that investigation, you still have questions, reach out to SanData. We need to make sure that the reports are working correctly. So that would be your appropriate chain of command, I would say. Check with your EVV vendor first, then you can check with SanData.
There is no direct number to SanData.
I believe they have a website or an online portal that you guys can use to log defects or if you have questions. And I believe we have a resources slide here at the
I
end.
was going to
that
say, I
you
think
can-
we have that at the end of the slide, the contact information. So
Yep. Okay, Terry, I'm going to turn it over to you to talk about the hard launch.
all right, I'm gonna just kind of fly through this kind of quickly since we are officially out of time, and we will have additional conversation before the hard launch comes. So there will certainly be more to come. So when we first did our soft launch, we were anticipating about 3 months, and we were thinking we were going to kind of base that on how we saw things going. Things are going great. Most of the claims that are being submitted are going through seamlessly. So we are going to start the hard edit April 1st for our provider types 26 and 28. And then hopefully all will go well with that. And then the following month, we will roll in our home health. And then at the end of that, we will roll in our Department of Mental Health. So, but we are for sure April 1st, unless something really bad happens between now and then, it's going to be for types 26 and 28. At that time, if there is not a matching visit in the aggregator for claims, the payment will not be issued. You will see that on your remittance advice, or you can use the reports that Carrie just showed you. But when that starts happening, then you're going to have to go in, identify the error. You'll have to make changes in your EVV system, send that to the aggregator. Once it's in the aggregator, then you'll need to resubmit the claim in order for those claims to pay. So our next slide is our timeline, and this is kind of what I just went through. Like I said, we are 99.9% confident of our moves to hard edits April 1st for our 26 and 28, and then we'll kind of play it by ear after that. But if that transition goes as smoothly as our soft launch did, it's very likely that it will be closely followed by our other provider types. So I just explained what the hard launch means. That just means that if there isn't a matching visit with those claims, that those will actually be denied and there will be no payment for them. RA codes, I'm going to come back to that in 1 second. Launch date, we've just confirmed that that's not going to change. The current EVV process, so what we have been asking everyone to do regarding EVV since the onset of this project really hasn't changed. We still need you to be entering correct, accurate EVV information for every single visit, for every participant that requires EVV, and it needs to be entered in a timely manner. So the only thing that has changed is that now when you submit a claim, there better be something in the aggregator to match that claim. So expectations around EVV haven't changed at all. We're just now saying, okay, we've been telling everybody what they need to do, and now we're going to know if you're not doing it and you're not going to get paid. So key EVV process hasn't changed. It's just now that it's going to be solidified by matching the claim to it. And I'm going to bounce back and ask Renee to speak just real briefly to the RA codes after the hard launch.
After the hard launch, you will not see the N363. You will see actually a claim adjustment reason code and a remark code for each one of the denials. They're not going to be real specific, but they'll be more specific than that N363. There are a few of them specifically that have the EVV or electronic visit verification in the remark code, but for the most part, you will know more information than what the N363, and it'll be at the end of because it'll be a true denial.
So
Okay.
we will have more to come as we get closer to that date, just defining the hard launch, but it will be better then. So I think this is very close to the end here. These are some things that we recommend you do before you submit your claim. You want to make sure that your visit is visible in the aggregator solution. If it is not in there, if you can't see it, then there's not a chance that your claim is not going to have an issue. You want to make sure that those visits are in a verified status. If they are in any other status, I mean, if they say process, that means the claim has already been hit up against them. If they're incomplete or omitted, then they might as well not be there either, because they're not going to be considered for the claim validation process. You want to make sure all these elements on your claim match what is in the aggregator solution, and we've talked about that several times. You want to make sure you have the right participant, the right date, the right service, your right provider Medicaid ID. You also want to make sure you have at least as many units in ease as what you have on your claim. And as we talked about, you really want to pay attention to those accrued minutes visits, because if you're billing for those on your claim, you want to make sure you have that visit so there's enough units. And then you're going to submit your claim. And then after you submit your claim, you're going to give it a minute and then check your RAs and your validation reports to see if that claim was successful. And the goal is, by the time we do our hard launch, when you run your list of claims that failed, that should be a very, very short list. So that's kind of what we're working towards, is like, if you're doing everything right with EVV, most of your claims should be successful. And then here's the resource page. This it tells you who to contact that if you're having problems. So where it says technical questions or difficulty logging in, that's how you reach out to SanData if you have issues with reporting or things that they don't have access to. We have our EVV website. If you missed any part of this, if you want to listen to it again, if you know somebody who'd be great to hear this, we will have the recording of this presentation posted on our website in the next couple of days. If you have questions that we didn't address during this conversation, you can send those to that ask.evv@dss email. I know a lot of you have gotten pretty comfortable with just emailing me, Terry, directly. This is actually my last week in this role, so it's super important that you start using that Ask EVV email address, or your email probably is just going to go into a big stack of unreads. So get comfortable with the Ask EVV. Renee is still going to be there. She will still be helping and working through some of these concerns. But soft launch has gone great. Providers are doing a great job. I know there's still some confusion and a couple of questions, but you guys really are doing very well, way better than I had hoped for. So thank you for that. I appreciate it. And we'll have more to come. Watch for the recording on this. Send us questions if you have them. And we appreciate your time today. Sorry we took a little extra, but we had a lot we wanted to share with you. So I don't know if anybody else has anything. That is all I have. All right. Well, thank you, everybody. And we will watch and try to answer questions as best we can. And there will be more to come in the near future.